now I will be talking on the importance of consent in documentation. So what is consent? It means voluntary agreement, compliance, or permission. What is the definition given by Indian Contract Act 1982, Section 13? It is when two or more persons agree upon the same thing in the same sense, they are said to consent. As per jurisdiction, consent signifies as possible defense against civil or criminal liability by the doctor. What are the legal basis of medical consent? If a doctor attempts to treat a patient without valid consent, then he will be liable under both civil and criminal laws, resulting in payment of compensation and or imprisonment. Informed consent was practically non-existent till the time CDRF, that is Consumer Dispute Redressal Forum, or commonly called as Consumer Protection Act, came into existence. Now the number of cases increased, so that's the importance of consent. Patient can now select their doctors and choose the treatment from the options available, or to refuse treatment even if the said treatment will save his life. Important reason for the failure of several medical consumer litigations is improper consent. Because I am sharing this because I am the medical superintendent of 1,800 bed hospital Jubilee. Every month at least one case is coming, and when you go through the case sheet, most of the time the consent form is incomplete. Consent and medical practice. Prior consent is mandatory for the purpose of all investigations, diagnosis, all operations including minor, major, all organ transplantation including eye donation, gastroscopy, all research purposes, and for the disclosure of medical records, compulsory in medical legal purposes, and before autopsy also consent is mandatory. There's a four type of consent. One is most important is informed consent. Second is expressed consent. Third is implied consent, and fourth is surrogate consent. What is informed consent? It is a voluntary acceptance after full understanding by a competent patient of a plan of medical care after physician adequately discloses the proposed plan, its risk and benefits, and alternative approaches. The components of an informed consent. It should be a patient and procedure specific. Take specific consent for each procedure or each surgery or each treatment. It should be a specific. It should not be a general like a blanket consent. What is a blanket consent? Consent for any treatment or investigations during hospital stay taken at admission time. It is called non-specific. That is enough for admission or investigation and a general treatment. For surgery or specific things, specific consent should be taken for specific or individual patient. The knowledge regarding the intervention should be in an understandable language and format. For example, it should be in Malayalam for Kerala, so that patient can make decision. What are the things you have to disclose to the patient before taking the consent? So you should explain to the patient what is a condition, what is a disease, or what is a diagnosis, and what are the investigations you are going to do, and what are the complications you are expected, and what will happen if no treatment is taken. That you should explain to the patient, and what are the treatment options available, and what are risks and benefits of this taking this treatment. And of course, you have to explain the cost and expense of the treatment, especially in a private hospital. And what is the outcome you are expected? If a catastrophe, if there's got a prognosis, that also should be explained to the patient. And what's the frequency of follow-up, because patient has to plan for that also. So informed consent is a continuous process. It's also having full knowledge and understanding of the condition, and patient has to make a decision voluntarily, accept that, and provide permission. And it is a continuous process, ongoing process till the treatment is complete. So these are some of the format of a consent at Jubilee. This will be written, it should be printed in English and Malayalam so that patient can understand. All these points are explained by one here, one by one, all the points are explained. And finally, it should be signed with the patient to witness, especially immediate relatives, and the treating physician, anesthetist, and as a witness from the hospital side, staff nurse also should sign. So the consent should be taken before starting the treatment or after the admission, or the counselors should explain everything, and doctor should also explain, and should be taken before the patient is taken to the operation theater. So what is express consent? So express consent can be oral or written. What is written? Written is preferred because advantage of easy proof and permanent form. Oral consent is also equally valid provided it is properly witnessed by one or two witnesses. Oral consent should be taken in the presence of a disinterested party like any literate paramedical staff, for example, our staff nurse of the ward or something. So oral consent, they should give the witness should sign the paper also. Written consent is mandatory in every diagnostic or therapeutic procedures or any medical legal examination. What is implied consent? Most common type of consent in both general and hospital practice. It implies consent to a medical examination in a general sense, but not to procedures more complex than inspection, palpation, and auscultation. So this implied consent is enough for an examination of the patient. For the detailed things, you should have a informed consent should be taken. In many cases, the extent to which consent was implied may later become a matter of disagreement. Patient will say that I have not agreed for that. So better to have in doubt, it is preferable the consent is expressed either orally or in writing. What is surrogate consent? When a patient is incapable of giving express consent, a substitute consent can be taken from the next of kin, generally accepted orders, spouse, parents, siblings, lawful guardians, etc. So it is also called a proxy consent, that taken from the parents of a child or close relatives or local guardian. Consent of relatives can also be taken if the consequence of informing the patient about the disease is more dangerous as compared to the actual risk of the procedure. So especially in a very advanced cancer or heart cardiac patient, it can be related, expressed to the relatives. MCA guidelines. The Medical Council of India has laid down guidelines and regulations for taking written consent before performing any operation. And it can be modified and simplified by the All India Ophthalmic Society. I will go through that later. For other treatment, general guidelines are as follows. For routine type of treatment, implied consent would suffice. But for detailed type of treatment, ideally express oral consent should be taken. For complex type of treatment, written express consent should be taken. Who can give the consent? For simple medical examination, children above 12 can give the consent. But for major diagnostic, therapeutic, or surgery, age should be above 18, IPC section 87 to 93. The patient should be mentally sound and should not be under any fear or threat or any false conception or intoxicated or sedated. That is very mandatory. The information applies to the said patient and specific purpose. So for each surgery, each patient, it is specific. Consent is not required, provided it's a medical legal case brought by the police under section 53 of the Criminal Procedure Code, or prisoners before taken to the jail or for examination under court of order. If the police is accompanying, consent is not required. Just like informed consent, there is an informed refusal also. If after knowing about the procedure, its side effects and other information related to a procedure, patient declines or refuses to undergo the procedures, it must be taken in writing with the signature of the patient, doctor, and witness. We cannot force treatment for any individual who does not want to receive it, except issues associated with public health, military personnel, or prisoners. In case of emergencies, may treat without consent. If life-threatening injury or patient not able to give consent, if patient is a comatose or severe injury, or surrogate decision maker or relatives not readily available, then you can give the emergency treatment, should act in the best interest of the patient. Obtaining consent. Before taking the consent, commencing the procedure, treatment, you should explain everything in clear, simple language, avoid technical terms, and sufficient time should be given to the patient for taking decision. And everything should be explained in patient's own language. Inquire whether patient understand. You ask some leading questions, and patient should be allowed to clear their doubts. If the patient cannot sign, thumb impression can also be taken, and all thumb impression or signature should be dated also. The process of informed consent concludes with the patient's consent or refusal. This consent is documented in a signed consent form, which is to be attached in the patient's medical record. It can be printed form, but as Malia has told, if it is written, handwritten by the patient or bystander, that will be more ideal. But most of the cases that may not be possible. The consent must be signed and dated by the patient and two immediate relatives of the patient, if possible. And of course, by the treating or admitting doctor or surgeon, and should be signed by the anesthetist if it is under GA. And as a witness, the staff nurse also should sign on the consent form. Quality indicators. If any of the essential element or requirement of the consent is missing, it shall be considered as incomplete. If any consent is obtained is invalid or void, for example, consent obtained from wrong person or consent obtained by wrong person, etc., it is considered as improper as a quality indicator. So these are the guidelines given by All India Ophthalmic Society. It is published as a booklet. I think last year they have sent to every members. So they are given 85 surgery list. So when you take the consent, you should specifically mention this guideline. So this surgery, what surgery you have to go give. So this is for cataract, cornea, glaucoma. This is for oculoplasty, refractive surgery. So these names you should mention. This is for retina and squint and neuro-ophthalmology. Total about 85 surgeries given by All India Ophthalmic Society. So this is a consent form. So daycare surgery also, before taking the patient to any procedure, you should take the consent, especially for fluorescein angiography. All these things you should take a consent. So bevacizumab or Avastin injection is an off-label thing. So you should take a consent. This is the consent form given by the All India Ophthalmic Society. It's 4 pages. You should take a consent. That's my monthly. So before the admission also, you should take a consent. Any admission, consent should be taken. So this is a COVID era. So any patient you are taking to treatment or surgery or what all things admitted, you should take a special consent for the COVID consent. That's called COVID or extra additional consent for COVID treatment during COVID period. So if you are giving anesthesia, even if the local anesthesia, it is better to have a consent form signed by the anesthetist and the surgeon and the patient. Of course, any surgery consent should be taken, signed by all the patient and doctor. So summary, consent is must for treatment. Preferably, it should be written and should be informed consent. Blanket consent has no legal value. So consent should be taken for the specific treatment and for the specific procedure. Consent is must for medico-legal examination. Consent provides a medical practitioner legal protection in case of action of negligence, although it is not defense for personal negligence. I think Dr. Jain Chinmay will narrate more on that topic. So regarding documentation, if it is not written, court will say that it did not happen. So do what you write. So and write what you do. So that is equally applicable for consent also. So what all things you are going to do, you should write and do according to that. So that's important for documentation. So these are my reference for American Academy of Ophthalmology, informed consent in ophthalmic surgeries by All India Ophthalmic Society guidelines, MCA guidelines and regulations, the IMA, Kerala State Branch, Professional Protection Scheme guidelines. So thank you very much.